Well, a warm welcome to today's talk. It's Wednesday the 22nd of September. Lots of questions coming in over the past months really on India. Why has India been apparently so successful in managing this pandemic after that terrible surge we saw last summer? Things seem to have gone dramatically well. Why is this? And really we need to call for more research on this, because I think there's something really quite interesting, or many things interesting, we can learn from the India situation. And we don't seem to be capitalising on this information at the moment. But let's look at the context of this first of all. So new daily confirmed cases. India, of course, we had that big surge there, now way down. United Kingdom, much higher, of course, in terms of per capita numbers. Here we have the testing. So we see that the testing in India is much lower than in the UK, but this is going to probably result in less cases in India being diagnosed than there actually is. So this is an underestimate of cases, but it's fairly consistent over a period of time. So I think we can use this because we've got consistent underreporting, we would imagine, in India. Now, share of the population fully vaccinated, well, in the UK, well over 60%. In India, we're about 14% now. And this is just picking up gradually for people fully vaccinated, which of course is needed for significant protection against the Delta variant. And then we look at the deaths in India. They did go up quite sharply then, as we knew, but they've stayed relatively level after that, whereas in the UK we do see a slight increase at the moment. So pretty stark data differences there between the UK and India. So what's going on in India? Well, I want to look at the home medical kits they've been using in India. So let's start off with the example of Goa first of all here. Relatively small population state, but as early as October 2020, October we're talking about this policy. Chief Minister in the presence of the Minister for Health. So this is all referenced largely in the Hindustan newspaper, which is a national newspaper in India. So what they did here is the population of Goa, they were giving out family kits, and this consisted of a pulse oximeter to measure oxygen sats, the amount of oxygen in the blood, so they could detect if people were being deteriorating. Digital thermometer, so they knew what the temp was. Paracetamol tablets. Now, paracetamol tablets would reduce aches and pains. The problem, to my mind, with paracetamol tablets is that also reduce the temperature, which is not always a good thing to do, but nevertheless, that's what's in these kits. Vitamin C, 30 tablets. Multivitamins with zinc, which we know is an important immunological required molecule, 30 of those. Vitamin D, which we've looked at again, 2 packs of vitamin D. Ivermectin, 12 milligram tablets, 10 of those. Doxycycline, 100 milligram tablets, 10 of those. Now, there was some thinking that doxycycline was going to be helpful in protecting against COVID-19, but it's looking like it's not. But in the Indian context, it could reduce the probability that people will get bacterial secondary infection. So it doesn't seem a bad thing, but anyway, we're just reporting what they did. 3 packs of face masks, 295 masks, hand sanitizer, 100 mils, and alcohol-based wipes. Alcohol-based wipes, 1 box with 20 pieces inside, and 2 pairs of gloves. So pretty sensible kit there, but interesting things to note in that kit. Things that really grabbed my attention there. Zinc, which we've talked about on this channel. Zinc, vitamin D, which we've talked about on this channel, D3. Ivermectin, which we've talked about on this channel. And secondary antibiotic treatment. So, interesting. That's what the government decided to give. Now, Uttar Pradesh did something very similar. So this is New Delhi here. This is the state of Uttar Pradesh up in the north of India. This is Nepal here on the border. So if you've ever been trekking or anything in Nepal, that's where you'll go. Very populous state, Uttar Pradesh in India. Population 204 million. So this is a very, I mean, this is just like a country in its own right, isn't it? I mean, these are absolutely huge populations in India. 204 million people in Uttar Pradesh alone. Now, bringing this up to date, this is a few days ago from the Indian press, Hindustan Times. No fresh cases of COVID in one day in 59 districts of Uttar Pradesh, in the 59 districts that make up Uttar Pradesh. The last 24 hours, they'd done 191,000 samples. 33 of those came back positive. This is quite staggering. That gives a test positivity rate of 0.01%. Now, when things were bad in India, we were pessimistic. We thought it might go on for some time, but the numbers seem to have come down really quite dramatically. So interesting, home medical kits in Goa, and as we'll see in Uttar Pradesh as well. So active caseload, 187 people. This was actually of a few days ago, about 3 days ago. Current people in Uttar Pradesh, out of 204 million people, 187 actually had COVID at the time, as opposed to the peak in April, which was 310,000. So massive success. So why is this? And this is what the world really needs to learn from. Targeted testing of specific groups. So the testing they had was limited. They didn't have as much testing as the UK or America. But they targeted it well. There was good early detection with good public health campaigns. There was good contact tracing. And actually, there was quite a high skill level of contact tracing in Uttar Pradesh from the HIV pandemic, for example. Isolation was well practiced, supported and enforced. And free and timely provision of medical kits and the treatment of the rural populace. So people were given free and timely provision of medical kits. So if they tested positive, someone will come along, hopefully the same day, with a medical kit. And we believe, I can't guarantee this, I've only got this from one source, but they were cheap, $2.65 per person. So remarkably inexpensive intervention. So this is from the Hindustan Times. This is a national newspaper in India. Hindustan, of course, is just a Hindi for Indian. State government gave out 50 lakh medical kits through village surveillance committees. Now, a lakh in Indian is 100,000. It's the way they say 100,000. They call it a lakh. So, in other words, 500,000 in the initial wave, as I understand this. So, state government's giving out these medical kits to people that were testing positive. Direct quotes from the paper. A team of doctors will supervise the admission of doses as well as distribution of the medical kits among the children in all 75 districts of the state. And these were also given out to families, as I understand it, as well. So again, going right back to August 2020, the government ordered ivermectin-based treatment kits. This is how it's reported in the Hindustan Times, ivermectin-based treatment kits. Not saying it's good, not saying it's bad, just reporting what it says. People with milder asymptomatic COVID-19 were given these kits and then kept in home isolation. They defined cases well. Mild cases where oxygen saturations are more than 94%. Moderate cases, oxygen saturations 90 to 94%. Indications for hospitalisation, saturations below 90%, which is the way they basically triage their patients. It's important to take other things into account as well, but that's a useful indicator. Now, of those who tested positive, 90% successfully treated at home, 10% did need to be hospitalised. So a pretty high hospitalisation rate, actually. Now, the treatment pack that were given out in Uttar Pradesh, and remember there was hundreds of thousands of these, contained ivermectin, doxycycline, vitamin D, vitamin C, vitamin B, zinc, paracetamol, a thermometer, and a pulse oximeter. Amazing that they could do them for this kind of money. I think if you live in India, do let me know if you're making pulse oximeters now. I assume you must be making them domestically. They use local COVID control centres, twice daily phone calls to household contacts to check on progress. They asked for oxygen saturation levels and temperature readings, so people were monitoring themselves at home. Check that ivermectin and doxycycline had been taken. And as we've said, doxycycline, no antiviral properties that I'm aware of. The data's not really indicating that, but bacterial secondary infection could be a problem. But they checked that they were taking ivermectin. So this doctor, head of the Department of Respiratory Medicine, King George Medical University, Lucknow, which of course is the capital of Uttar Pradesh. Overall mortality in 2020 in India was 2.4%. Uttar Pradesh, it was only 2%. So that is down quite a bit, really. When you think of all the millions of people, that is a very significantly lower numbers of mortalities, of deaths in Uttar Pradesh. that is the beauty, that is the success story of ivermectin, this doctor says. That's a direct quote from the article about him. And he's also a brand ambassador for COVID vaccination in India. So this doctor is, from this report, very highly pro-vaccine. So he looks like this doctor thinks the same way as me. He wants to protect people with vaccination, of course. And if there's a useful antiviral treatment, he would like to use that, of course. Not that I'm prescribing any drugs, because I never do. Now, the success story in Uttar Pradesh was actually highlighted by the World Health Organization, no less. So that was good to see. And they put up this sort of press release on it. Uttar Pradesh going the last mile to stop COVID-19, being lauded as an excellent case. The Uttar Pradesh state government has initiated house-to-house active case finding of COVID-19 in rural areas. And it goes on to give the statistics of what the government has been done, and impressive it is. Talking about the monitoring teams, talking about the testing, talking about the mobile vans in Uttar Pradesh, all from the WHO. The World Health Organization supports Uttar Pradesh government in training and micro-planning. That's good. So more about that. Those with symptoms were tested and given medical kits and informed on quarantining and isolation, both at home and in hospital. Now, the WHO seemed to run out of space there, so they didn't give the details of what is in the medical kits, unfortunately, but we have done that from the sources I have given you the references for. Don't take my word for it. Click on the references, check it out for yourself. So there's just a few of the references there that I've been using. Uttarakhand state also in the north, population there 10 million. Now this was also... No, that's something else I'm going to show you. So Uttarakhand, population 10 million. State level clinical technical committee chief secretary Om Prakash to all district magistrates recommended. The panel has recommended the ivermectin tablet as mass chemo prophylaxis. So chemo means it's a chemical or a drug. Prophylaxis means preventative. To effectively control the surge of COVID-19 infection, that is their view. That is their view. Now, I've managed to find this graphic here, which shows an interesting correlation. So new daily cases in Uttarakhand, they're the numbers up there. This is the time spell here. Now, this is when the All Indian Institute of Medicine and the Indian something for medical research, Committee for Medical Research, they added ivermectin to their protocols there. It was implemented, as far as I can gather, in Uttarakhand around about the 11th of May, which would be there. So it would take that week to get out, and then, strangely enough, the cases dropped quite dramatically. Interesting. It's what you call a temporal correlation. Doesn't prove causality, but it's an interesting temporal correlation. So I thought that was all quite interesting. Now this is from this is an official CDC health advisory. I've put the link in so you don't need to read it now. You can peruse it at leisure. Ivermectin is a US Food and Drug Administered approved prescription medication used to treat certain infections caused by internal and external parasites. When used as a prescribed for approval indications, it is generally safe and well tolerated, so that's good to know. And then they go on down there and they look at the increase in prescriptions for ivermectin. Now, as far as I can gather, this is data from the National Prescription Audit Weekly database. Collects data from a sample of approximately nearly 50,000 US retail pharmacies, representing 92% of retail prescription activity. So this is officially distributed by pharmacists, so therefore is presumably officially prescribed by doctors, and we see this big increase as of August. But of course then, as we mentioned yesterday, it goes on to recommend strongly against taking any drugs that are not prescribed by a doctor, and indeed veterinary preparations, which of course we agree with. So I thought that was a few interesting things about India. So what can we say for sure? The cases in India have gone down quite dramatically, and epidemiologists and government bodies around the world need to give us something more definitive than my quick sketch here of why that is the case, because I strongly suspect that there is something to learn from the Indian experience and the success of the Indian experience. And because of the relatively low levels of vaccination, I don't think we can attribute it to vaccination. Can we attribute it to other things? We don't know. We need people to tell us this. Has that got implications for prescribing and things in other countries? Well, this is what we need official bodies to tell us. You can't get that from a YouTube video. We need people to tell us about this. But there's some interesting temporal correlations in India. Now, I'm just going to do a couple of feedback items. Just show you maybe some of these. John, what is the matter with you? Why on earth would you take the risk of injecting children for a disease that they are already 99.9% immune to? This is from yesterday's video where we talked about the Pfizer report on giving vaccines to 11 to 15-year-olds. I wasn't saying give them, I'm just reporting what Pfizer says, just the same as in this video. I'm reporting what was said. I am not recommending necessarily that people vaccinate young children. I'm not recommending that they don't. I'm just reporting what it says. You have to assess this data for yourself. And I'm certainly not prescribing any medicines or vaccines. That's not my job. So the answer is I'm reporting. I'm reporting. I'm not trying TDS. I'm not trying to tell you what to do. I wouldn't dream of telling you what to do or trying to tell you what to do or giving you medical advice. MC, what next, John? Vaccines as part of the birthing process. How do you sleep at night? Well, yeah, I mean, that would become absurd, MC, but we take your point. I think everyone understands your point. Again, I reiterate, I am not advising treatments. I'm reporting what other people and hopefully reputable people are saying with references. Now, we also talked about getting emergency care. And this is a really serious point now because Lynn said, I said take immediate medical advice. Let's just say that the wait times in ERs in the Boston area are 8 to 14 hours. It will be hard to get immediate medical attention. No idea, that's just what Lynn said in the comment. If that is true, then 8 to 14 hours is too long for many medical conditions and too long for any painful conditions. D says, seek immediate medical attention is a joke. Sorry, John, my recent brush with TIA is a transient ischemic attack, like a mini stroke. Had me waiting 3 hours on the floor at home, waiting for an ambulance. Well, this is just laughable because you're already outside the time window where that could be effectively treated. This is a disgrace. Waited for an ambulance in the UK. Then an hour in the back of an ambulance as A&E was overcrowded. To top it off, I was then past the golden period when the treatment could have been effective. To lessen the damage, could not be thrombolised, the doctor said, so he couldn't be thrombolised. I'm just wondering if this was a stroke as opposed to a TIA as well. So they couldn't give the blood thinners, it was too late. Now have a life-changing disability to get over, which I'm so very sorry to hear, D. It sounds like you've had a cerebrovascular accident, actually, from what you say, because a transient ischemic attack, the effects would normally be transient and self-limiting. UK NHS is not working and is not available for emergencies. You're absolutely. This is a totally valid point. There's quite a few things. Myocardial infarctions, cerebrovascular accidents that have to be treated within a very limited time frame. If they are treated within a limited time frame, the treatments can be dramatically effective. If they're not, the golden opportunity is lost. So I take the point entirely. So people, of course, say seek immediate medical attention. That means if something goes wrong, a particular governing body might say seek immediate medical attention. So no one can come back to them and say, well, just a minute, this has gone wrong. They said, well, I said seek immediate medical attention. So it's a bit of buck passing, really, isn't it? So I agree. So we call on the world's academics, epidemiologists and government advisors to be clear on exactly why. We've pointed out some correlations. We've pointed out some practices in India. What I want to know is why. So we look to these official bodies to tell us why, and to tell us officially if that will inform policy in other parts of the world. Thank you for watching this video.